Hi, Mrs. Russell. I'm going to ask you a few questions today.
Okay.
What area or areas of nursing are you interested in and why?
Case management and emergent nursing care is my interest right now. I enjoy case management because it is an opportunity as a nurse to be able to behind the scenes make a difference in helping to arrange for procedures and so forth that the patient might need while they're inpatient at the facility, and then going ahead and being able to incorporate discharge and what they're going to need after that to initiate that and make sure they get what they need.
Tell me about your clinical experiences. Which rotations did you enjoy the most and why?
My current clinical experience is in the emergency room department, and the rotation out of the clinicals, I spent all of my clinical time in the emergency room, but of course we did do different things as our topic. The what I enjoyed primarily was med-surg. Just pure emergent nursing was what I found to be the most interesting.
What is the biggest mistake you ever made, and how was the problem resolved?
The biggest mistake I've ever made in nursing would be that I was fairly new nurse as an LVN, and I gave a patient 100 units of insulin, and it was a mistake that was actually based on transcription. And so what ended up happening behind that was there was a peer review and so forth, and I did remedial education and actually presented a class based on insulin, which taught me a lot. And then also out of that, what came out of that is the MARs for that particular facility were actually changed, because during the peer review, all of my peers actually thought the same dosage as I did based on the way that the pharmacy had printed it out.
Tell me about yourself. What do you see as your strengths? Why?
I feel like I'm a reliable person. I feel like I'm compassionate. I am very loyal, and I tend to have a lot of empathy for others. And I think that all of these are my strengths because it helps me, especially in case management and what I do, to be able to assist the patient and anticipate their needs when I need to, and also to empathize with their situation and to be able to help them once they leave the facility with avenues and ways to get help.
How about your weaknesses? Why?
My weaknesses? I think my biggest weakness is that I am a people pleaser, and I tend to go out of my way to make others happy. And in nursing school, for going for my ADN, the one thing that I did learn is that in leadership and management, that's really not something that you can do. And I have had to work on understanding that not being able to make everybody happy does not equal failure. And so for me, that is a big weakness because it puts me in positions a lot of times that I don't want to be in because I am trying to please someone else instead of speaking up.
Tell me about a staff nurse who most impressed you and why.
I had a nurse that I worked with years ago. Her name was Lorna Carrasco. And I was most impressed with her because she was very organized. She was able to keep all of her patients with everything they needed. She left on time all the time. And not only was she able to chart appropriately, call the physician, do her patient care, but she also was the primary one to go around and help others and to do education and teaching and assisting. And that always, being a nurse on the floor, I knew how hard that was, and I feel like she was awesome because she was able to do those things.
How would your most recent nursing instructor describe your performance in the clinical setting?
I think that the person that I'm working with right now would describe my performance as appropriate. And she's told me actually that I am a person that just gets in there and tries to figure out what needs to be done and anticipate the needs. I'm compassionate, just like I said, and I do tend to identify with the patient and have a good bedside manner, so to speak, when I'm dealing with the patients.
Tell me about your most challenging clinical assignment and what you learned from it.
Well, my most challenging clinical assignment was actually taking care of pediatrics. All pediatrics is very challenging for me because it's something I'm not familiar with, and the way that I had to handle it was to get as much information as I could about the patient and pediatrics and how to treat the patient, and then just get in there and do it. I could not hesitate, because hesitating ended up, well, I wouldn't do it. So I just had to get in there and get it done.
What skills do you feel you have gained from your past work experiences that may help you in this position?
Well, because this is a case management position, I feel like the experiences in different settings as a case manager and in management help tremendously with this particular position. I have been in case management in acute facilities, and now I'm in a rehab facility, and I've also dealt in long-term care, and so I've had the opportunity to see patient needs over different areas where they're discharging from different areas with different needs, and I've learned a lot right now in the rehab setting, because we have a lot of indigent patients, and so I've learned resources, community resources and so forth, that I didn't realize that were out there. So that, bringing that into this position, being able to use that when I'm dealing with the patients on the phone through the insurance who are having needs and so forth, I feel like that will really help me to meet their needs and to be able to help the company as well.
Tell me a little about yourself. How would others describe you?
I am more of a family person. I enjoy nursing thoroughly, and I think that that's because I do enjoy caring for others. I have 3 kids and a grandchild, and I'm married, and I've been married a very long time. And I'm the type of person that, like I said earlier, I'm very loyal. So this position is not something that I take lightly, and it's not something that I would be here today and then not tomorrow. I'm very committed.
What are your future career plans? Where do you expect to be in 2 or 3 years, in 5 years?
In 2 or 3 years, my hope is that I have gotten my BSN, and let's go even shorter term than that. My initial goal, as soon as I'm finished with school, is to get my case management certification. My CCM. And then after that, I want to go back to school for my BSN, and then hopefully in 5 years from now, I will have been able to at least get my master's.
We do not have any openings at the present time in the area in which you have indicated you are interested in. What would you be willing to accept a position in another area? If so, what other areas interest you?
Actually, at this time, because I am employed, I think that I will just wait until you do have a position open. The other areas that interest me, you probably don't apply to this setting, and that would be emergent care nursing, and so I know that that's not what you guys do here. So right now, I think I'll just wait until you have something open.
Tell me about a time when you had to establish priorities during one of your clinical experiences.
Every day that I went into the emergency room, priorities had to be made. That's part of emergent care nursing, and that's what I like about it, is that I am constantly being challenged and I'm constantly learning something new, because all of the other avenues of nursing that I've worked doesn't require quick thinking, quick assessment, and quick action. And emergent care nursing require all those things, so it presents a challenge for me, and I thoroughly enjoy it, and I enjoy the fact that when you're prioritizing, you have to think about the basics as far as ABCs.
Tell me about a time when you went out of your way to assist a family or patient even though you really didn't have the time?
I had a patient that recently was here and he was visiting in this area and he had fallen, so he was hospitalized. And unfortunately, the patient left his luggage at the airport. So he had no clothes, no means to even identify himself. Actually, his birth certificate and all of his personal items were in his luggage. So I took it upon myself to go and get his items from the airport.